I'm going to be talking about not just one trial, but two trials. So you're getting twice the amount of pleasure out of this talk. So the first trial, as on the title of this talk, is called Fresh Start, which is a trial that's taking place in Leeds, and that we're trying to recruit people who multiply self-harm. But we're also starting another trial called Safe Pit, which we hope to run in Leeds as well as other places. And that's for the other group of people who self-harm, in other words, non-multiple self-harmers. And for the sake of, because they don't have a catchy name, I'm going to call them people with acute self-harm. So the two trials have the same kind of process, but they are slightly different and they're tailored for the different populations. So for Fresh Start, that's for people who multiply self-harm, that's over here. The treatment intervention that we are evaluating is 12 sessions of talking treatment that's been adapted for people who self-harm. And we're not just looking at one type of talking treatment, we've got three talking treatments that we're looking at: CBT, acceptance and commitment therapy, and psychodynamic interpersonal therapy, which is a therapy that I've been involved with in Manchester. And many years ago, when I was a consultant liaison psychiatrist in Manchester, and aware that people coming to the department, coming to A&E, having self-harmed, had no service whatsoever, I set up a psychological treatment service run by nurses who were trained to deliver very brief psychological treatment. So I've been interested in trying to provide treatment in this area for a very long time. So Safe Pit, which is the trial for people who've only self-harmed once or twice, it involves a shorter treatment, only 4 sessions of treatment, and that is only PIT, psychodynamic interpersonal therapy, that we are evaluating in that study. The reason for the difference in duration is people who self-harm once or twice tend to do that because there's an acute problem in their life, whereas people who multiply self-harm, yes, there may be an acute precipitant, but it's a behaviour that has become to be something that they do on a more regular basis. So there's more kind of underlying psychological issues that need to be addressed. So the treatment is longer. And in particular, when we think about multiple self-harm, some work done by researchers in Leeds has shown that understanding the function of self-harm, the purpose of self-harm, can be important. And it can be used very successfully in either of the 3 different treatment approaches. And basically, the purpose of self-harm for a lot of people, not all people, but for most people, falls into one of these 4 different categories. And they don't have to be mutually exclusive. A self-harm episode can have all of these categories as an underlying function. But it's basically a protection from suicide, so it's actually harming yourself to stop yourself doing something worse. It's something that provides soothing or comfort to you. It's something where you're trying to communicate distress to somebody else. It's a form of communication. Or it's just trying to block feelings. Now, there's lots of things in between that, but those are the main 4 groups. And in terms of our therapies, once we can establish the purpose or function of therapy, then in CBT you'd look at cognitions that may be driving those kinds of functions. In ACT, you'd be looking at flexibility and how inflexible the person might be. And in psychodynamic interpersonal therapy, you're looking at basically feelings and relationships that are underlying these functions. So these are the 3 interventions for Fresh Start, and this is the intervention for Safe Pit. It is just psychodynamic interpersonal therapy. Now, the next question is, how do you deliver treatment for people who self-harm in the NHS? And this is a real problem, because if you don't have a service, if you try to refer, for instance, people to the local IAP service, often, not always, but often IAP will say that they're not set up to treat people with these kinds of issues or problems. If you then look to other kinds of psychological treatment services, they may have very particular treatments, for instance, DBT for a very small subgroup of patients who have perhaps are diagnosed with borderline personality disorder, not a term that I like. But the vast majority of people who multiply self-harm don't actually meet the criteria for borderline personality disorder. And also most services are highly selective. So a lot of people who we see coming through the emergency department just wouldn't be suitable for those kinds of services. So the model in both trials is the model that I used over 20 years ago in Manchester, which is to take very experienced practitioners who are already skilled in managing and assessing risk. So it doesn't scare them, it doesn't worry them, it doesn't frighten them. They have that experience, they've seen lots of self-harm, and then we're teaching these people basic psychotherapy skills, and we're giving them then ongoing supervision. So we're not sending them on a course for a year to become therapists. We're giving them a quick brief training, and then we're then going to supervise them closely and help them, guide them with the patients that they're seeing. And for each of the services that we're trying to engage, we're looking mainly for liaison practitioners, we're training them, and then we are offering them supervision. Matt, who's one of our supervisors, is going to be talking about this a little bit later. So each of the studies is going to have 12 sites across England. Most of the sites are different, but not all the sites are different. In some sites, the two studies will be running in parallel. And for Fresh Start, we're going to recruit hopefully 630 participants over 12 sites. That's 3 to 4 participants a month. And for SafePit, it's a little bit higher, 770 participants. And what Nav was saying in his previous study is that at the moment there are many quite small trials of psychological treatment that suggest that talking treatment may be of help. But there aren't very many large studies. In fact, I think these are the largest studies of psychological treatment that have been delivered in the NHS for adults with self-harm. And it's only really when you deliver large studies that you can really begin to determine whether or not talking treatments actually have some impact. So where we are at the moment, we've approached many trusts to participate in these two trials, 45 sites. We've been doing this during the height of COVID. It was very good timing that we had a feasibility study that was due to start in March 2020. We did manage to complete that feasibility study that was delayed for 6 months, and then we're just starting the trials now. So we're still looking for 1 or 2 more sites, but we've got most of our sites. And in terms of the outcome, what are we trying to look at in terms of outcome? Well, in both studies, we're looking at whether people repeat self-harm. That's an important outcome, but also psychological distress, which is measured by this measure, the CORE-OM, which is a common measure of anxiety and depression and other forms of psychological distress. I'm not going to talk about this slide, just to say that Fresh Start started in October. Again, we just hit Omicron, so we're struggling, and SafePit has just opened. So thank you very much.